I'm going to go ahead and call the committee to order and call the roll. But before I do, I wanted to make a few announcements. There are people who are listening online, and there are people out in the hallways. We have an overflow room available to the left, so Senate Committee Hearing Room number 2 is open. We have our hearing room for only an hour and a half, so we're going to have to be moving very, very quickly. We have 11 bills to hear, and we have 5 that we're planning on execing out. If we don't get to executive session, those 5 bills will not have a chance to pass. This will be our last hearing of the session. And so I am reserving half an hour to work through that. That means we have 1 hour to hear 11 bills. That means every bill sponsor is going to be given basically 2 minutes, and then we're going to do a minute for, a minute against, and let people go on the record and collect the papers for each bill, because otherwise we're not going to get a chance to get to all these bills, and we don't want things to die. So with that being said, Madam Secretary, please call the roll.
Senators Coleman,
Here.
Carter,
Here.
Arthur,
Here.
Gannon,
Here.
Moon, Thompson Raider, Washington.
With 4 members present, we do have a quorum, and we are going to go ahead and start with Senator Razor's bill. Is Senator Razor here?
Yes, he's right.
Oh, sorry, Senator Razor, I didn't see you.
Thank you.
Okay, Senator, please proceed when ready.
Thank you, Madam Chair. Members of the committee, for the record, Senator Greg Razer here. The bill before you, this is Senate Bill 62. The bill before you is really a cleanup bill on language from the trigger law passed in 2019, I believe it was. I have heard from attorneys, from hospital legal staff, and from former prosecutors that a legal argument can be made that we have unintentionally outlawed contraception in the state of Missouri. And let me walk you through the legal argument. In the trigger law, pregnancy is defined within the definition of gestational age. And it says that a pregnancy is measured from the first day of a woman's last menstrual cycle. The first day of the last menstrual cycle, which means a woman is pregnant before she has intercourse or perpetually pregnant. It then has 2 different definitions of abortion. The one is what you would traditionally think of, and the second says an abortion happens when a woman uses any instrument, device, medicine, drug, or other means or substance with an intention other than to increase the probability of a live birth. So any medicine, drug, procedure intended not to increase the likelihood of a live birth. So if you are pregnant before you have intercourse and you take a birth control pill, which is intended to decrease the likelihood of a live birth, you have then just committed an abortion under this law, is the legal argument. What my bill does is just clarify contraception. It's not considered an abortion. It is perfectly legal in the state of Missouri, and that's all that it does.
Thank you, Senator, for your testimony. If someone would like to testify in support, you have 1 minute. Please begin when ready.
Good morning. My name is Lexi Hall. I'm a registered lobbyist with the Associated Students of the University of Missouri. We'd like to go on record in support because it cleans up the statutory language, which would ensure that there's an explicit exemption for contraceptives so that at any time the abortion law could not be interpreted to exclude pregnancy prevention methods like contraceptives. It's essential that contraceptives remain accessible for not only students but Missourians across the state. According to our annual survey, approximately 20% of students in the University of Missouri system use oral contraceptives, and this is an important use case for pregnancy prevention, but also to manage menstrual pain, treat acne, and to prevent ovarian cyst ruptures and endometriosis flares. The continuity of care is extremely important with oral contraceptives, and we must ensure that these are not illegal overnight with any sort of interpretation of that law. Thank you.
You were right on a minute, but we didn't catch your name. Can we get
Lexi Hall.
Thanks, Lexi.
Thank you.
We'll now have 1 minute for testimony in opposition. Go ahead and begin when ready.
Thank you very much, Madam Chairwoman, members of the committee. My name is Arnie C. A.C. Dienoff, and I really think that we need to put the brakes on this legislation. We need to do some thought process. We need to do some legal diving into the issue rather than jumping at trying to come up with a solution. With this late in session, I think it's too late to try to throw this into the mayhem of all the bills from the Senate and the House. And so I ask that we put this aside and decide this issue next year. That's my testimony, Madam Chairwoman.
Thank you for your testimony.
Thank you.
At this time, we'll be taking witness forms. You don't actually need to come up and provide your witness form during and between the different bills if you didn't get a chance to testify in support or opposition on this bill, on Senate Bill 62 or any subsequent bills. For those who are listening in the overflow room, you do need to actually be present to fill out a witness form, but to go on the record, we'll collect them at the end of the hearing. If you'll just put them in a pile, there is a table in the overflow hearing room as well, or in here when you're done on the floor here. So that then concludes our hearing on Senate Bill 62. Senator, we're going to move to Senate Bill 646 next so that you don't have to wait through the next hearing.
Okay, thank you, Madam Chair. Again, for the record, Senator Greg Razer from the 7th District here to present Senate Bill 646. This is one of a few bills that I think Senator on the committee has introduced another one to address missing children within the foster care system. This bill specifically would mandate the Children's Division personnel to immediately report missing children to law enforcement, to the National Center for Missing and Exploited Children within 2 hours of determining the child is missing. Law enforcement, in turn, must keep a child's case open until the child is found. It requires the division to develop appropriate search protocols, including bringing into law some existing division internal policies. Specifically, the case manager must inform parents, a juvenile officer, and the child's guardian within 24 hours of a child going missing, must maintain contact with law enforcement, family, and providers, and must continue documenting and reporting to the court about the ongoing efforts to recover the child. It also prohibits the division from closing a case until the child is found or is 21 years of age. It requires the division to maintain an up-to-date photo of the child in their case file, and it instructs the division to develop preventative protocols for identifying children at risk of disappearing and mitigating such risk. Happy to try to answer any questions.
Thank you, Senator. That was under your 2 minutes. Is anyone here to testify in support? Please come forward. Begin when ready.
Thank you, members of the committee. Kendall Steele, Vice President of Policy at the Center. I'd just like to echo what Senator already shared as an overview of this bill. I would like to highlight the significant problems that are facing Missouri's children in foster care. There are 3 reports to draw your attention to. One, a 2021 report from the U.S. Office of Inspector General analyzing cases of nearly 1,000 Missouri children who went missing from foster care in 2019. They found the division failed to report children as missing in nearly half of those cases they reviewed. They further rarely attempted to reduce the children's risk of going missing, failed to protect them when they went missing, and did not effectively use resources with them. Again, 2022 OIG report found over a 2.5-year period 1,780 instances of Missouri children going missing. Put another way, 4% of Missouri's children in care are missing. Third report, 2023, OIG found state agencies continue to violate federal mandates by not properly reporting children.
Mr. Steele, thank you very much for coming and for your testimony. That report, I don't know if everyone has had a copy of. Can you make sure that the reports that you're mentioning are emailed to the committee directly?
Certainly, and they're highlighted in our written testimony previously submitted, but we'll do.
Thank you very much. Anyone in opposition to Senate Bill 646? Seeing none, this concludes I'm sorry, please don't forget, if you're here to testify in support and didn't get a chance to submit your testimony, to provide written testimony. And this concludes our hearing on Senate Bill 646. Senator Carter is going to present for Senator Moon, who's out, on Senate Bill 356. Senator, if you'll proceed when ready. Senator, please proceed.
Madam Chair, committee members, I'm Senator Jill Carter, here representing my colleague on this bill. I'm going to defer my testimony and time to the witnesses that are here in favor and in opposition to this legislation. This is the Abolition of Abortion in Missouri Act. This is his piece of legislation, and due to a family emergency, he's unable to attend here today. So if there are any witnesses here to testify, I yield my time to them.
Thank you. Thank you, Senator. So what we'll do then is we'll have a minute and a half for pro and a minute and a half for con, so that we can cede your time to them. So if I understand from Senator Moon's office that he had two witnesses that he was very much wanting to speak on. So why don't we divide that time and give a minute to each of you, rather than have just one testimony support and one opposed? And we'll do the same if the people who are opposed would like to split their time to have two people speak. So go ahead and begin when ready.
Thank you, Madam Chair, committee. My name is Bradley Pierce. I'm an attorney. I'm the president of the Foundation to Abolish Abortion, and I'm here today in favor of Senate Bill 356. I'm an abolitionist, which means that I hold the supposedly extreme position that murdering anyone should be illegal for everyone, because everyone is created in the image of God. According to a study published in the Journal of the American Medical Association, over 1,300 abortions are expected to take place in Missouri this year, and Missouri law allows for it because current state law denies equal protection. This bill would fix that. 188.021 does prohibit telemedicine abortion. However, I do not believe, and I cannot find any other attorney or organization in the country, pro-life or pro-abortion, that believes these provisions apply to prohibit a woman from ordering or taking abortion pills in the state. And the 1,300 plus abortion pill packages I described earlier are ordered from only one overseas provider who cannot practically be prosecuted here and is not being prosecuted.
Thank you so much for your testimony. And the next person who'd like to testify, and I think we'll just stick with support, and opposition, so we're not going back and forth. So if there's someone else who'd like to testify in support, please come forward.
Thank you,
proceed.
Madam Chair.
Go ahead when ready.
Sorry. Thank you, Madam Chair and members of the committee. I'm Reverend Jeff Durbin. I'm the head of End Abortion Now, and I'm testifying on behalf of 60 million plus murdered children in our nation. This particular bill is just a bill of equal protection. That's it. It says something that's unassailable. What's in the womb, of course, we believe is in the image of God. What's in the womb, incontrovertibly, is a unique, distinct human being. We've been here in history before, members. Only it was a different kind of human. We used to say, I know it looks like a person, it's not a person, it's a black man. We drew a circle around ourselves and said, it's human technically, but we can kill them, we can abuse them. They did it also in Germany. They said, I know it looks like a human, it's not a human, it's a Jew. We all look back at those atrocities and that evil and tyranny, and we say it's wicked. It's happening in our day. What this bill says is unassailable. What's in the womb is human from the moment of fertilization. I call you to establish justice. I call you to do your duty before God. I call you to repent, turn to Christ, establish justice, do what's right before God. There's a day of judgment in history ahead of us.
I want to
Please do
thank
what's
you
right.
so much for your testimony. Those who would like to testify in opposition, please come forward. Mr. Lee, do you know, is there going to be two people who are testifying in opposition, or are you wanting to?
I don't know, but I'm going to be very brief, Madam Chair.
Okay, go
Chairwoman, members of the committee, Samuel Lee with Campaign Life Missouri to testify in opposition to Senate Bill 356. I've written testimony here, which I've submitted and have emailed to you. Just a couple points. Last year about this time, many national and state groups issued a statement saying that they are opposed, I'm going to read that, they are opposed to any measure seeking to criminalize or punish women because it is not pro-life, and we stand firmly opposed to such efforts. And although we were not given an opportunity to join in that statement, we certainly join in the sentiments and the position of those groups, which included Missouri Right to Life, for example, here in Missouri. I would also point out in my written testimony that since 1825, when Missouri's first law prohibiting abortion was passed, Missouri has never, ever criminalized a woman for having an abortion, and I think that policy should stay the same. Thank you, and I'm happy to answer any questions.
Thank you very much for your testimony. Is there anyone else here in opposition? I'm sorry,
I've already said.
she's going to go ahead and come forward and testify. Susan? Go ahead when ready.
Thank you, Madam Chair, members of the committee. For the record, Susan Klein, representing Missouri Right to Life. I'm going on record in opposition to the prosecution of women. I believe that all of us are seeking the opportunity to save unborn babies, and we have done that in our laws. We are part of the group of the national organizations as well as statewide organizations across the United States that signed on to the paper that basically says we want to reach out to women and have compassion for them and help them to see that they have alternatives to abortion, but we don't want to prosecute them. A lot of them are being coerced or forced to have abortions, and we are not going to participate in that.
Thank you for your testimony. This will conclude our hearing on Senate Bill 356. I would like everyone again to remember that if you were not able to speak, to please submit your testimony in writing if you're able to be in the overflow room or in the hallway. And if you are here specifically for either Senate Bill 62, Senate Bill 356, Senate Bill 646, to please give your seats to those who are in the hallway who maybe were wanting to come in and onto those hearings and go and listen to the rest of the hearing from the overflow room. Mr. Dorman, would you like to ask if there's anyone in the hallway for bills that have not yet been heard and they'd like to come in for a seat? Thank you. Senator Gannon, we're going to go out of order and have you present your Senate Bill 665 while we're waiting for Senator Koenig to arrive. Go ahead and begin when ready.
Senator Gannon, representing District 3. Good morning. Thank you for the opportunity to present Senate Bill 665. 665 deals with helping kids who have been removed from their home help find placement with a relative before being placed in the foster care system. 665 offers a few reforms to our current system. It establishes clear guidelines for conducting timely, thorough, relative searches in place of our current vague laws. It will increase process accountability by outlining and mandating search documentation with the court. It would require front-load relative searches for improved placement stability. The bill states that Children's Division would be instructed to complete ongoing search within 6 months of a child entering care. Finally, Senate Bill 665 would improve stability by treating long-term foster families the same as a relative. Thank you.
Thank you, Senator Gannon. Is anyone here to testify in support? Please come forward. Yes, go ahead.
Good morning. My name is Timothy Faber with the Missouri Baptist Convention. I'd like to simply say removing a child from their home is already a very traumatic event. If a child can be placed with family or someone close whom they already know, it may help mitigate that trauma. So we support the bill.
Thank you for your testimony. I'm stopping. There was still an additional minute left, so if there's anyone else who'd like to testify in support of Senate Bill 665, please go ahead and proceed when ready.
Certainly, Kendall Seal, Vice President of Policy for the Center for the Rights of Abused Children. Just to highlight our support for this bill, current Missouri law currently doesn't really clarify what due diligence search means, and that's really what this is intended to correct. It's also, I would say, as a second point, intended to promote stability. 40% of children are in care for longer than 2 years, which is significant. We're blasting through federal guidelines and benchmarks for this, and we'd like to see that stopped.
Thank you for your testimony. Is there anyone here to testify in opposition to Senate Bill 665? Anyone else for informational purposes only? And I just realized I didn't do that for all of the other bills, so my apologies to anyone. If you are here for informational purposes for the other bills, go ahead and submit your written testimony, and we'll make sure it's distributed. Okay, thank you. That concludes this hearing on Senate Bill 665. Senator Koenig with Senate Bill 594. Please proceed when ready. Mr. Dorman, would you let people know as we're going from bill to bill, if they're in the hallway for the next bill, that they should come in? Thank you, sir.
Thank you, Chairwoman, members of the committee. Here to present Senate Bill 594, Senator Andrew Koenig from 15th District. What this bill does is it prohibits state agencies from contracting with companies that pay for abortions out of state. It's as simple as that. And I think this is a good thing because we need to create a culture of life here in the state of Missouri, which we are already doing, and this would further that, and I'm happy to answer any questions.
Thank you, Senator, for your testimony. Is there anyone here to testify in support of Senate Bill 594? Well, everybody is getting well adjusted to we only have 2 minutes for in favor and 2 minutes against. So I'm just going to start my clock on in favor and then pause it when people are done. And if somebody wants to switch, then we can do that. So just in case you're wondering why this is changing, I just think it's easier than me trying to keep the timer. So go ahead, please.
Again, my name is Timothy Faber. I'm with the Missouri Baptist Convention. Yes, Missouri is a pro-life state, and to not pass this bill would at best be hypocritical, if not helping those avoid the laws that we have passed. This bill, in fact, will help companies and political subdivisions to keep the law and not try to circumvent it by assisting those who would kill innocent preborn persons.
Thank you. Is there anyone else in testify in support? Please come forward. Go ahead and proceed.
Thank you, Madam Chairwoman, members of the committee. Samuel Lee with Campaign Life Missouri to go on record in support of Senate Bill 594. This would not only implicate companies that seek contracts or have contracts with the state, but also the city of St. Louis or any other municipality which is using public funds to pay for abortions outside of the state. So we support this legislation.
Thank you for your testimony. Anyone else? It looks like you have about a minute left. Go ahead, Susan.
Thank you, Madam Chair and members of the committee. For the record, Susan Klein, representing Missouri Right to Life, here to go on record in support of Senate Bill 594. We've been working to protect and make sure that public monies are not used for abortion in any way, so we support the bill.
Thank you for your testimony. Is there anyone here? We have 44 seconds left. I shouldn't have switched the rule. I'm feeling really foolish for that because it takes so long to transition between the witnesses, so that was really dumb of me. So we're not going to do that again. I'm going to do that for the next group because I don't want to be unfair on this bill, but then we're going to go back to the old way. Sorry about that. Okay, so is anyone here to testify in opposition? Please come forward. Go ahead and begin when ready.
Thank you. All right, Madam Chairwoman and committee members, my name's Sam Howick-Horst, and I'm from St. Charles. I'm here as a regular person, and I'm here to speak in opposition and also share my abortion testimony. In 2015, I was 22 years old while going to school at Mizzou and working as a residential advisor and yoga instructor on campus. The day I found out I was pregnant, I was alone in my dorm bathroom, unaware of all the hurdles I was about to face both personally and systemically. My ex-partner made it evident that he wanted no part of me or a pregnancy. My family was disappointed, ashamed, and couldn't promise me a stable home if I were to pursue my pregnancy. And from the minute I found out, I understood the clock was ticking and that I only had days to make a decision. While going to school and working full-time, I then had to manage and plan another 2 appointments across state lines, at least 72 hours apart, all while trying to secure rides. Since I was not 6 weeks along, I was able to go through with a medication abortion, and when the day came for my second appointment, I was lucky enough to go through the steps with another woman hand in hand. We had only met each other that day, but you would have thought we were lifelong friends the way we held each other throughout the process. Again, I'm here today because abortion is normal and a fundamental human right. Access to abortion is essential and popular. Abortion is healthcare. Abortion is an act of love. And regular people who have abortions deserve dignity and respect. These bills will cause lasting harm to Missourians, their families, and their loved ones. I urge you to vote no. Thank you.
Thank you for your testimony. Is anyone else here to testify in opposition?
Yes.
Proceed when ready.
Hi, my name is Heather Donahue. I live in St. Louis. I'm here today to testify about my experience crossing state lines to obtain an abortion, which we still do today because it's completely illegal. I had a birth control failure at 21 as a student with 2 jobs, and now at 37, I feel ready to become a mother. But at the time, I went to Illinois to get an abortion. My older sister was a teen mother I became an aunt at the age of 3, and so I knew the very.
Thank you for your testimony. If you want to
Thank
make
you.
sure and submit your written form. Is there anybody else who would like to submit written testimony in favor or in opposition? And is there anyone here for informational purposes? Seeing none, that concludes the hearing on Senate Bill 594. I'm up next to present Senate Bill 685. My vice chair is needed in another committee, so Senator Arthur, would you mind taking over the chair?
Get my timer.
Senator, may I speak in?
Yep, whenever you're ready.
Thank you so much, Madam Chair and member of the committee. This is a bill that we have actually voted off of the floor as an amendment, and I wanted to make sure that it had its own standalone hearing as well as we start the process for next year. Or maybe it'll even get into one of the other omnibus bills that's moving right now. But it is changing the way that we do inspections for some of our nursing home facilities and allowing accredited agencies as well as the commission that currently has that authority to count, so we're not having multiple pieces of red tape. So I think that this is kind of just a sensible government cleanup bill, and that concludes my presentation. Thanks.
Thank you for that. Any witnesses testifying in support?
Madam Chair, members of the committee, my name is Michael Grote. I'm appearing on behalf of Arrow Senior Services. We support this legislation. Essentially, what this would do, as the Senator mentioned, is allow the Joint Commission, which currently already does this exact same thing for hospitals in sections 197-100 and 197-258 for hospice, as well as home health in Chapter 197. This would eliminate red tape as it allows a Joint Commission accreditation process to account not for licensure, but just for the annual survey that takes place afterwards. It reduces the burdens on some of our facilities, but actually keeps the standard of care very high because the Joint Commission standard is actually higher than what we see with the department. There's been a couple of language changes that we've been requested to make, which we have made based on the House hearing that the Senator currently has as substitute language as well. With that, I'd be happy to take any questions.
Thank you for your testimony. Any witnesses in opposition?
Thank you very much, Madam Chairwoman, members of the committee. My name is Arnie C. A.C. Dinoff, State Public Advocate. And as we all know, accreditations, you have to pay for them. They don't come for free. And so when you pay for them, some things get slid by or some people get by. I've been in nursing homes with loved ones, and I've seen a lot of code enforcement issues, and safety issues. All of our seniors are important. Their safety is our number one priority and concern. Accreditation, like I said, requires a fee, and to receive the designation. Well, guess what? If they're doing a good job, they would receive that designation without being charged. I believe that the Department of Health and Senior Services must retain the right of a surprise investigation or allow for complaints from citizens throughout Missouri. These accreditation agencies tend to favor nursing home industry. And this
Thank you
bill
your
is for the
testimony.
nursing home industry,
Anyone else
and I'm
here
opposed.
to testify in support? Anyone else in opposition? Seeing none, that concludes the hearing on Senate Bill 685. I'll turn it back over.
Thank you, Senator. We're now moving to House Committee substitute for House Bills 117, 343, and 1091. Representative Shields, please proceed when ready.
I apologize, I missed which bill we're hearing first right now. I missed which bill we're hearing first. I'm sorry. Thank you.
Go ahead and proceed when ready.
Yeah. Thank you. Good morning, Madam Chairwoman, members of the committee. I'm Brenda Shields, representing District 11 in St. Joseph, Missouri. House Bill 177, 343, and 1091 allows qualified first responders to administer naloxone to a person suffering from apparent overdose without the need to act under a medical director. The bill also changes the definition of an opioid antagonist to be inclusive of other drugs and devices approved by the FDA that are yet to be invented. Invented for the purpose of blocking the effects of an opioid overdose. And last, the bill allows fentanyl testing strips to be manufactured, distributed, and sold in the state of Missouri. This bill passed the House 157-0. And with that, I'll be happy to take any questions.
Thank you very much, Representative. Is anyone here to testify in support? Anyone here to testify in support? Mr. Dorman, do you want to call the hallway again, see if anyone's here to testify in support? Are they coming?
Yeah, there might be. There should be, but it's passed on a bunch of bills already.
Okay, anyone here in opposition? Proceed when
Madam
ready.
Chairwoman, my name is Arnie C. A.C. Dinoff, State Public Advocate. I testified against this bill in the Missouri House on February 21st. I believe that there should be medical oversight, there should be a medical advisor, and there shall be training provided to all law enforcement officers. I think to allow police officers to do this on their own without medical oversight is just not proper and not safe. For those reasons, I'm opposed to this bill.
Thank you for your testimony. Is there anyone here for informational purposes only? Seeing none, that concludes our hearing on House Bill
Can I
117.
make one statement?
No, I'm sorry, we're going to move to the next bill. Okay, House Committee substitute House Bill 575.
Okay. Thank you. Good morning again. I am Brenda Shields, representing District 11, and thank you all for hearing this today. House Bill 575 eliminates cost sharing of diagnostic breast cancer imaging, and allows women to have a screening mammogram without a referral as required by law. Diagnostic testing includes MRIs and ultrasound.
Representative, can you wait just one moment until the door is closed? It's very hard to hear when the door is open.
I was trying to be in a hurry for you. Sorry.
Okay, go ahead. Sorry for interrupting you.
Okay, so I'll just start with House Bill 575 eliminates cost sharing of diagnostic breast cancer imaging and allows women to have a screening mammogram without a referral as required by law. Diagnostic testing includes MRIs and ultrasounds. Many women delay testing and diagnosis, increasing their chances of late-stage cancer, and the longer it takes for a woman to detect breast cancer, her 5-year survival rate declines. Diagnosing breast cancer early, first and foremost, it saves lives. It reduces the overall cost of health care. Treating cancer in its later stages is very expensive. A U.S. study estimates that our nation's cost savings from early diagnosis would be $26 billion per year. It keeps women from becoming medically bankrupt and having to go on Medicaid, and it keeps women in the workforce paying taxes, and contributing to the economy. Language such as House Bill 575 has been already passed in states including Texas, Arkansas, Oklahoma, Louisiana, Illinois, and Colorado. And it's time for Missouri to be included on this list. In Missouri, it is estimated that 5,700 women will be diagnosed with breast cancer this year, and 820 will die. Thank you, and can I answer any questions?
Thank you. Is anyone in support of House Bill 575? Please come forward.
Madam Chairman, the committee, thank you for having me. My name is Allison Zupon. I'm a physician that I read mammograms every day. I drove here legs shaking from Kansas City because if you've ever had to look a woman in the eye and tell her that she has breast cancer, the only thing that makes me able to do that day after day is the knowledge that I can then say, we found it early, you're going to be okay. I break hearts several times a week with this news. And we know that mammograms are not enough. For 50% of women, they have dense breast tissue, and finding a cancer in that breast tissue is like finding a snowball in a blizzard. I need ultrasound, and women can't pay for it on their own a lot of the time. And to have this bill pass, we'd find cancer earlier, we save lives, we save money and the cost of treatment. So I highly support this. Thank you.
Thank you for being here and for your testimony. Anyone else would like to go on record? And we're going to keep going back and forth like we were for the other hearing. So we're going to just hear one in opposition.
Madam Chair, Shannon Cooper today representing Blue Cross and Blue Shield of Kansas City, as well as America's Health Insurance Plans. We want to go on record in opposition. I want to be clear. These individuals have insurance. They're just subject to the copay that they agreed to when they bought those health insurance policies. There's nothing in state law that... Oh, sure. Okay. Want me to completely start all over? Okay. So there's nothing in state law that would prohibit these centers from waiving the cost share portion of these patients if they feel it is that important to get them in there. I've made that suggestion in the House. I'll continue to make that. But again, these individuals have coverage. They have agreed to the terms of this policy. And therefore, we are opposed to the bill. Be happy to answer any questions.
Thank you for your testimony. Anyone here for informational purposes only? That's going to conclude our hearing on House Bill 575. Oh, you just go. No. So for those who are just joining the hearing, I just want to make it clear we had 11 bills to hear and an hour to hear them. So every bill was getting 5 minutes. You're getting just 2 minutes to present, a minute or 2 minutes in favor, 2 minutes ago and opposed, and then everybody on the record. Just please bring forward your form and submit it. The hallway is full with people who also didn't get to testify on other bills. I understand that's frustrating.
Thank you very much for your time.
Thank you. We're now going to, that concludes our hearing on House Committee Substitute for House Bill 575 and 910. We're now moving to hear Representative Haden's House Committee Substitute for House Bill 906. Representative, if you'll wait to start talking until the doors are closed. Okay, thanks so much. Go ahead when you're ready.
Thank you, Madam Chair, and members of the committee. I'm Representative Ken Haden, District 43, and I'm here to present House Bill 906. This is a lead bill that I was asked to carry by the Health Department. We're all aware lead is a very important issue in small children. This committee has heard this similar bill, I think, recently. Senator Gannon had and passed it out. This bill was heard in the House, and it had a 10-0 in Children and Families to pass out, 8-0 on the consent committee, and 150-0 on the floor. Basically, we all have bills. We all have things that we pass, but then it needs to be cleaned up after we've tried it and didn't work. This is what Health Department's trying to do with this bill. This bill removes the public health notification to some health boards, public health agencies, and other people. It protects the identity of a child who tests positive, the physician who tests them, and has several policies about consent of the parent. It also, one of the main things it does is that it provides a medical education for children under 4,
and with the consent of the parent. And every child under 6 will be assessed annually with a questionnaire, and those who are at high risk of lead poisoning will be notified and tested by blood test with the consent of the parent. So again, this is a cleanup bill. Any questions?
Thank you, Representative. Is anyone here in favor? Please begin when ready.
Hello, my name is Ben Terrell. I'm the Legislative Director for the Department of Health and Senior Services. I want to thank the committee for their time. I want to thank Representative Haden for his time in presenting this, and I want to thank Senator Gannon for carrying this on the Senate side. As Representative Haden said, this is a cleanup bill. The standards for what kids need to be tested for lead are all over the place, and this is clarifying what those are and how those work. Thank you.
Thank you. Anyone here to testify in opposition? Seeing none. Anyone here for informational purposes? Seeing none. If you weren't able to testify in support, please submit your written testimony. And that concludes our hearing on House Bill 906. We're now moving to House Bill 1034. House Bill 1034.
Anybody here for House Bill 1034?
Representative McMullen, please proceed when ready.
Thank you very much, distinguished chairwoman and members of the committee. I'm here to introduce House Bill 1034. The original bill basically states that a child that is placed into foster care, when they're considering the placement, that they will put into consideration religious consideration for that placement. So the old statute was written in 1950. This brings it up to date before Child Protective Services and all these other agencies. Right now, the way the current law is written, this religious consideration for placement only directly deals with the judicial branch, and as time has passed, they don't really consider placement for children anymore. It's done through protective services and also through third-party contractors. So this makes sure that it puts them under the current statute. It's already a best practice within the Foster Care Coalition, so it wouldn't cause, it's already currently used. So there was an amendment that was added that I agreed with, and what that does is it provides it's for the for missing persons for guidelines for children in foster care. So what it does is it provides clear minimum requirements for what constitutes as due diligence for searching for relatives, requires thorough and immediate communication to relatives so they can make an informed, timely decision on whether to care for the child, provides a more robust court documentation of relative searches to improve accountability for timeliness, including responses for relatives, requires each child in care to be provided a state-issued photo identification or up-to-date photograph on record in immediate reporting to the law enforcement when the child goes missing, so they have an up-to-date picture, so when they're looking for them, that's really important. And then prohibits releasing missing children from jurisdiction in closing cases of any child until they are found or reaching the age of 21.
Thank you, Representative. Anyone here to testify in support of House Bill 1034? Go ahead and start whenever you're ready.
Thank you, Madam Chairwoman, members of the committee. Olivia Wilson here on behalf of Foster and Adoptive Care Coalition. They are a foster care placement agency located out of St. Louis. We approached Representative McMullen to sponsor this bill after an incident in which a foster child was not permitted to attend their father's funeral. The foster child was a Muslim child, and the foster parents didn't align with that same religious value. This is a very rare circumstance, but legislation like this would just simply update our statute. Right now, it's only specific to the courts, and the courts don't place children as much anymore. It's largely children's division. So we just insert that in there to make sure that there is a best practice to try to place children with a home that will either be accepting of their religion or of the same religion. I'd be happy to take any questions.
Thank you for your testimony. Is there anyone here in opposition? Seeing none, thank you. That concludes our hearing on House Bill 1034. We're now moving into hear House Committee Substitute for House Bill 1082. Representative Thompson, please proceed when ready.
Good morning, Madam Chair and committee. Thank you for the opportunity to be here today. Senate House Bill 1082 relates to mental health care. The increasing need for competency restoration and limited number of available beds is a growing concern. There are over 200 individuals who have been found incompetent to proceed by circuit courts and awaiting inpatient admission to the mental health facilities for the purpose of competency restoration. New legislation will allow individuals to receive outpatient or jail-based restitution, which services that would reduce the number of clients waiting for inpatient beds. This will allow to find incompetent to proceed treatment sooner. The Department of Mental Health statute only provides for inpatient services now. This also changes and cleans up the language in the mental health statutes, and it passed the House 153 to 1.
Thank you for your testimony, your presentation, Representative. Is there anyone here to testify in support of House Committee Substitute for House Bills 1082 and 1094? Go ahead and proceed when ready.
Thank you, Madam Chair and Committee. My name is Nora Bach, and I'm the Director of the Division of Behavioral Health at the Department of Mental Health, and we are here to testify in support. We appreciate Representative Thompson fronting this for us, and this will help us address our wait list of individuals who are currently waiting for admission to a facility. This will allow us to reach in and begin services earlier. And as he said, this cleans up some language that was currently in statute that referenced mental health coordinators, which no longer exist.
Thank you very much for your testimony. Is there anyone here to testify in opposition to House Committee Substitute for House Bill 1082 and 1094? Seeing none, that concludes our hearing on House Committee Substitute for House Bill 1082 and 1094. Thank you, Representative. With that, I'm looking for a second as I make a motion to go into executive session. We have a second. Yeah, thank you. We have a second. We're first going to consider House Committee Substitute for House Bills 117, 343, and 1091, introduced by Representative Shields, modifying provisions relating to controlled substances. I'm now making a motion to take up House Committee Substitute for House Bill 117, 343, and 1091. Do I have a second? Senator Gannon seconds. House Committee Substitute for House Bill 117, 343, and 1091 is now before the committee. There is a substitute which has been distributed ending in .04C, and I'm making a motion to adopt the committee substitute. Do I have a second? Senator Gannon seconds. Is there any discussion on the substitute? Seeing none, all those in favor of adopting the committee substitute say aye. All those opposed, nay. The ayes have it, and we have adopted the substitute. I'm now moving to vote for House Committee Substitute for House Bill 117, 343, and 1091 do pass. Do I have a second? Senator Gannon seconds. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman. Aye. Carter. Arthur. Aye. Gannon. Aye. Moon. Thompson Rader. Washington. Aye. So it is.
By your vote of 4 yes and 0 no's, you have adopted the substitute and have voted do pass Senate Committee Substitute for House Committee Substitute for House Bills 117, 343, and 1091. We're now considering House Committee Substitute for House Bill 575 and 910, introduced by Representative Shields, modifying provisions relating to breast examinations. I'm now making a motion that we take up House Committee Substitute for House Bill 575 and 910. Do I have a second? Senator Gannon has seconded. A House Committee Substitute for House Bill 575 and 910 is now before the committee. There is a committee substitute which has been distributed ending in .04C. I move to adopt the committee substitute. Do I have a second? Senator Gannon has second. Is there any discussion on the substitute? Hearing none, all those in favor of adopting the committee substitute say aye. Aye. All those opposed, nay. We have adopted the substitute. I now move to vote Senate Committee Substitute for House Committee Substitute for House Bills 575 and 910 do pass. Do I have a second? Senator Gannon seconds. This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman. Aye. Carter. Arthur. Aye. Gannon. Moon. Thompson Rader. Washington. So that would be 4-0.
By your vote of 4-0, you have passed Senate Committee Substitute for House Committee Substitute for House Bills 575 and 910. We're now taking up House Committee Substitute for House Bill 906, introduced by Representative Haden, modifying provisions relating to lead poisoning. Senator Gannon had the companion bill that we voted out quite early in session. I'm now making a motion to take up House Committee Substitute for House Bill 906. Do I have a second? Senator Gannon seconds. House Committee Substitute for House Bill 906 is now before the committee. I'm voting to move House Committee Substitute House Bill 906 do pass. Do I have a second? I don't know why this keeps going off. I'm sorry. Is there any discussion? This is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman.
Aye.
Carter. Arthur. Gannon. Moon. Thompson Rader. Washington. 4-0.
By your vote of 4-0, House Committee Substitute for House Bill 906 has passed. We're now considering House Bill 1034, introduced by Representative McMullen, modifying provisions relating to child placement. I now make a motion to take up House Bill 1034. Do I have a second? I now move to vote out House Bill 1034 do pass. Do I have a second? Senator Gannon seconds. Is there any discussion? There is a roll call vote. Madam Secretary, please call the roll.
Senators Coleman.
Aye.
Carter. Arthur. Gannon. Moon. Thompson Rader. Washington. No. So it'll be 3-1.
House Bill 1034 has passed by your vote of 3-1. We're now going to move to take up House Committee Substitute for House Bills 1082 and 1094, introduced by Representative Thompson, modifying provisions relating to mental health care. Do I have a second? Thank you. House Committee Substitute for House Bill 1034 and 1094 is now before the committee. I now move to vote House Committee Substitute for House Bill 1082 and 1094 do pass. Do I have a second? Senator Gannon seconds. There is some discussion on this bill. There was a change that was made as a commitment to members of the House that would be made before we moved forward. My office wasn't made aware of that change, however, until about 8 o'clock this morning when we came in, and it was not enough time to amend or get a Senate committee substitute out. So I am personally committing that if this bill comes to the floor, I will offer the amendment if the Senate handler does not put it into the Senate substitute. But this is our last meeting of this committee, and I don't want to slow down the bill or kill the bill by not voting it out. So just everyone on the committee know that there is a technical fix that needs to be made in the bill. Any other discussion on the bill? I honestly can't, but I'm going to find the email and read it to you.
I do have the email. Give me one second.
I think there are members of the department that are here. If you'd like to come forward and fill out a witness statement and go ahead and testify as to what that change is, that's probably the easiest thing to do.
Hi, I'm Angie Stuckensteiner, Legislative Director for the Department of Mental Health. The prosecutor, the Association of Prosecutors had a concern about one sentence that was in that jail-based competency restoration language, and it is the director of the department or his or her designee shall determine the locations and conditions under which treatment shall be provided. And they just weren't comfortable with it being that black and white. So we said, sure, we'll take that out and we'll work through that. And if we need to come back later, we will. So we did make a commitment to them that we take that sentence out. And it is out in all the other versions that are out there except this one. So we just wanted to make sure it was consistent. So.
Does anyone have any questions of the witness? Okay, thank you so much for your testimony. I'm now looking for a motion to vote do pass House Committee Substitute for House Bill. Oh, no, I'm sorry. This is a roll call vote with no further discussion before the committee. Madam Secretary, please call the roll.
Senators Coleman. Carter. Arthur. Gannon. Moon. Thompson Rader. Washington. 4-0.
By your vote of 4-0, the committee has voted do pass House Committee Substitute for House Bill 1082, 1094. And Senator Washington, Senator Arthur, Senator Gannon, and Senator Carter, and Moon, and Thompson Rader, this is our last hearing. It was a doozy, and I appreciate very much all of the work that's been done by the committee. So thank you. And with that, I'm adjourning the Health and Welfare Committee for this year.